Hi, I'm research psychologist Rogers Follensbeek. Have you ever wondered why talk therapy works as well as it does? Well, ever since modern psychology was first practiced, the efficiency of sitting down with one's therapist and having a guided conversation has never been truly explained. This mostly because the mental health community hasn't known how we humans are psychologically put together or structured. So they could only guess as to why talking with someone could have the therapeutic benefit it seems to have. Historically, for example, the first practitioner to be surprised about how effective talk therapy could be was Freud himself. What's interesting is that in Freud's time, talk therapy offered no real dialogue. The patient did all the work. The therapist just listened, took notes, and then listened a little more. Freud's initial talk therapy he called the purging of the soul. And it was an experiment in the effects of using a patient's monologue as a therapeutic tool. After all, it seemed to offer measured relief to his patients. Well, if you've ever read my book, It's Not Your Fault, you'll know that we're all relational beings whose lives depend in part on the relationships we have with our outside world or environment. Indeed, that environment becomes a part of who each one of us actually is. When the values that our environment have are contradictory to who we are genetically, we suffer psychologically. However, when that world affirms who we are, we grow in a positive, forward-moving manner. Let me explain this. Your therapist becomes a temporary environment, and when well-trained, they form a relational connection with you that is totally non-critical, positive, and uplifting. Remember, your therapist will know who you really are. That's precisely why today's talk therapy works. You, the patient, are allowed to be yourself while relating to an affirming environment. You can finally be you and not get clobbered for it. From where I sit, an integral component of successful talk therapy sessions is for your therapist to fully understand just how vital their role is in your emotional stability. Just to know that sometimes a clinician may champion a new and different approach to labeling you this way or that. This approach follows the medical community's diagnostic rigors, but overlooks what structured psychology already recognizes. The unique person that you are is simply having a little trouble fitting in with some portion of their environment. They are simply being who they are, but in the wrong place. The therapist may think that they must cure you when there isn't anything medically wrong with you at all. All you need is to find the right environment to live in. Clearly, there are reasons for your suffering that might require more extensive methods of research to identify, but for many of us, a simple change of environment might reduce that suffering in a significant way. Just remember, when you find yourself in a relational environment that has no axe to grind, the real you can finally emerge as a positive, totally acceptable relational being. However, knowing that our psychological lives depend on how our personal needs and wants coincide with those of our environment, the chance that conflicts arise in our daily lives should surprise nobody. The trick is to know that by understanding how we're psychologically structured, we can find that environment that most coincides with who each one of us actually is. If you're naturally drawn to fashion and design, it'd be the best thing you could do to live with designers. And if it's atomic reactors that catch your fancy, Los Alamos, New Mexico might be the right place to live. Just make sure you don't stay in Los Alamos if you're all about fashion. or remain in Paris if your world is all about nuclear fusion. Thank you for watching.
Understand why we all think, feel, and do the things we do. Read It's Not Your Fault by Rogers Follensbeek. Link in the comments below.